This is my 15.3 treating sports injuries follow-up video, follow-up PowerPoint from the videos we have already made towards the assignment. So the first injury that will be seen in the video is the response to head injuries, and the response to head injuries is summarized or should be followed by the use of DRAPS. Which stands for danger response, shout, airways, breathing, CPR. So firstly, I'm going to speak you through if you came upon this situation, you would react to this. So when a head injury occurs, the first aider should immediately clear the area, which can involve stopping the game and getting everyone to leave. First, ask for a response from the injured participant, calling their name or asking if they can hear you. If there is a response, get them to sit up and apply an ice pack until more help arrives. If there is no response, then shout for help and for someone to call an ambulance. You should not do that. Call the ambulance as the participant needs to be left alone. Or needs not to be left alone, sorry. Then check their airways, which is done by lifting the chin slightly and putting an ear to their mouth and looking down their chest for breath, so movement of the chest. If airways are blocked, then and they're are blocked and they're not breathing, then putting them into the recovery position and waiting for an ambulance should be the next steps. If there is no response, then CPR has to be carried out. This is done by interlocking the hands and pulling the hands up to ensure the fingers are not pressing. Then with the base of the hand, apply pumps to the center of the chest. 100 compressions per minute, per minute. 30 compressions should be carried out, and then 2 breaths within the 100 compressions. The breath is put directly into their mouth and to blow air into their chest. This is should be done until the ambulance arrives. Moving on to the responses to bleeds, and this can be summarized with the use of SALT taps. So see, ask, look, touch, active movement, passive movements, and strength. The video previously seen shows an athlete that has suffered a cut during a competition. So in this situation, the first aider that would have carried out the steps of SALT taps, the first aspect of SALT taps that should be carried out by a first aider is C. This refers to the individual seeing the injury that has occurred and acting to stop the game that is going on around the injured player. This is just to ensure no further injury is caused. The first aider should then ask the individual where the pain is, and then to what extent the pain is hurting. The stage is to actually look. The next stage is to actually, after asking, is to look at the injury that has occurred and begin to judge the severity of it. After this, the first aider must apply pressure and touch the injury to the site of the area of pain, and to what extent the pressure is causing the increase in pain in the individual. The next stage of SALT taps is active movement. So once they've checked the pain, if the pain is limited, then the individual will be asked to perform some active movement, or can the athlete actively move the area of injury and the limbs around the area of injury. Then the first aid would continue to the next stage of response. If active movement is fine, and move on to the next stage of recovery. However, if movement is limited, the third stage will then begin to apply bandaging to the bleed. to ensure it stops it. If movement is not limited, then the first aider will firstly check for passive movement, which is when the first aider stretches the injured limb over the active range of movement, so ensures that there's a almost full range of movement in the injury. Then finally, the first aider will check the strength of the injured leg, for example, standing on a cut leg or something. If the responses to these are good, then the first aider will simply apply bandages and treat the athlete. If not, the athlete might have to look to go to hospital if the injury is that bad. Next is muscle response. Responses to muscle or ligament strains. So responses to muscle sprains or ligament strains can be defined with two acronyms. So first of all, the first aider will look to use sole taps as similar to the bleeds, but then for the recovery stage and afterwards, for the actual healing stage, they use the Price method, which is protection, rest, ice, compression, and elevation. So as seen in the video, if a strain would occur, going through a first aider would then go through the Price method. So to start with, they would look at protection to prevent further injury. So for example, if a basketballer has suffered a thigh strain maybe in a game, they would look to first of all assess the range of the movement and the severity of the injury, but also stop the game around them to ensure that muscle didn't become any more further injured, protected injury. And also this would involve more using splints, potentially bandaging to help protect that muscle, maybe taping the muscle to ensure it was held in place. Then the next part of the Price method would look at the rest of the limb. So a first aider may recommend not putting any weight on the injured area for 40 to 72 hours. So you may look to use crutches, splints, potentially bandaging during this period, taping, and to try to avoid any injury, any more putting any more pressure on the leg, because otherwise that could damage the injury further. And then moving on to the ice of the area. So you could use an ice pack to ice the area, or potentially even a cold bath, and this will just help to further improve the injury, and it will improve the swelling that is seen for the first the swelling period, so the first 48 hours. And if you can use ice, it could be helpful to not use it too long, as it could potentially lead to damage of the muscle tissue. Compression of the injury, so this will obviously be with bandaging, tape, elastic wrap, and this is just to ensure that no further damage is done to that strained muscle. Moving on to elevation, this is quite straightforward. This is just ensuring that you're getting blood away from the area. So if, say, I've injured my right thigh as mentioned before with the basketballer, he would raise his leg, and that would just attempt to take away some of the swelling by getting moving the blood away from the injured area. And then moving on finally to the sole taps method of treating muscle or ligament injury. So obviously, although I've gone through the Price section first, that will come second after the sole taps method. So with the sole taps method, obviously for muscle strains, firstly seeing the strain, so seeing the injured player go down with a strain, he might motion towards where the area of the strain. Then ask him if he's okay, if he's in any pain. Look at the injury to see if there's any. You would obviously check the surrounding areas as well. Ask any game that's taken place to stop. You would then look at the injury, see if there's any visuals, signs, so maybe early swelling, potentially some bruising early on. You would then touch the area of pain and ask them how severe the pain is when they touch certain areas and whether this is becomes an issue. You would then look for active movement, so you'd ask them to move their legs, see if they can move the area that's been strained and the surrounding joints. You would then help them with passive movement, so you would stretch over the active range of movement, and obviously that's only if they pass that active movement stage. If they don't pass the active movement stage, then obviously you're not going to test their active range of movement, are you? And then finally you would ask them to put some weight on it, some weight bearing for the strength. And after all this, you can then assess how severe the strain is, whether they can carry on, they need to come off, and that will be the summary. Finally, moving on to the response to broken bones or fractures, and going back to the what would happen in the first aider's point of view from what's seen in the video. So obviously again they would use the soul taps method, and when a broken bone occurs within a sporting environment, the game should be stopped immediately. The goal for the first aider is to try to minimize the pain and make sure that the casualty is as comfortable as he can be. Move them away from where it has happened, so move the surrounding players away from the injury, and if not, make sure that the injured player, the one with the broken bone, remains warm, comfortable and secure where they are. And then start going through the soul taps method. You would usually see a deformation of the bone, so this would be the looking stage. If it's broken, and if not, looking at the casualty, you can see they are holding or gently touching the area where the pain is. So again, the touch method, touch aspect of it. Then you ask them what happened and what they think has happened, where does it hurt, or what they think they've done. Looking at the injury, you should look for deformations or swelling and immediate bruising. Next, you need to determine the severity of the injury. So if the casualty lets you touch the area lightly and gently, this should allow you to feel the severity of the injury, be it a fracture, break, or just a sprain. If possible, you also need to ask the casualty to move the area of injury. If it is their arm, then ask them to move their wrist if possible, or if it's an arm, ask them if they can extend. If it's their leg, ask them if they can extend their leg or produce any movement at all. If it is clearly snapped or broken, then you won't ask them to do this due to the pain that it would put them in. Having diagnosed a broken bone, have the casualty sit them up, against either a wall or a chair, where you can simply apply first aid. In the video, it is a broken arm that is seen, so you will have them holding their arm out slightly in front of them, so you can tie a sling around their arm with one corner of the sling under their arm and the other their shoulder around their neck, the other corner over the front of their arm. Tie both corners together in a knot behind the neck, tight enough to support the arm. the 90-degree corner below the elbow and tuck in so the arm